If you wake up and notice these 5 symptoms, go to the hospital immediately. If you're over 60 and you wake up experiencing any of these 5 symptoms, your life could be in immediate danger. Every year, thousands of seniors dismiss critical warning signs as just getting older, and it costs them their lives. What you're about to learn could be the difference between waking up tomorrow or never waking up again. These aren't the typical health tips you've heard before. These are emergency red flags that demand immediate medical attention. And the 5th symptom? It's so surprising that even doctors sometimes miss it. But first, let me tell you about 68-year-old Carl, who almost died because he ignored symptom number 3. His story will shock you, and it might just save your life. Today, I'm going to show you the 5 critical symptoms that should send you straight to the emergency room. No questions asked. You'll discover why these warning signs are especially dangerous for people over 60, how to tell the difference between normal aging and life-threatening emergencies, and most importantly, when to call 911 versus when you can drive yourself to the hospital. I'll also reveal the one symptom that 90% of seniors completely ignore, even though it's responsible for more emergency room deaths than any other warning sign. Here's what we'll cover. First, the chest symptom that doesn't feel like what you'd expect. Second, the brain warning that has nothing to do with memory. Third, the breathing issue that's not about your lungs. Fourth, the headache that could end everything in minutes. And fifth, the stomach problem that's actually about your heart. But here's the thing, if you're watching this video, someone you love needs this information, so hit that like button right now if you want to protect yourself and your family, because we're about to dive into content that could literally save a life. Let's start with the first symptom that fooled Carl for 3 hours. 3 hours that almost killed him. Let's talk about the chest symptom that doesn't feel like the heart attacks you see in movies. When you're over 60, your heart doesn't always scream emergency the way it does in younger people. Instead, it whispers. And if you're not listening carefully, you could miss the most important message your body will ever send you. Here's what most people don't know. After age 60, only about 40% of heart attacks come with that crushing chest pain you see on TV. The rest feel completely different. Carl, the 68-year-old man I mentioned earlier, woke up at 5 a.m. with what he described as bad indigestion. It felt like someone was sitting on his chest. Not stabbing him, not crushing him, just sitting there, making it hard to get comfortable. For women over 60, heart attacks are even more deceptive. Dr. Sarah Williams from Johns Hopkins found that senior women are 50% more likely to experience what we call silent symptoms. Instead of chest pain, they feel overwhelming fatigue, nausea, or pain in their jaw, neck, or left arm. One patient, 73-year-old Nancy, told me she thought she had food poisoning because she felt sick to her stomach and couldn't catch her breath. Now here's the critical distinction you need to understand. Heartburn stays in one place and gets better when you sit up or take antacids. A heart attack spreads. The discomfort moves to your shoulders, arms, neck, jaw, or back. It doesn't improve with position changes, and antacids don't touch it. If you're diabetic and over 60, pay extra attention. Diabetes damages the nerves around your heart, which means you might not feel pain at all. This is called a silent heart attack, and it's responsible for 25% of heart attack deaths in seniors. The only signs might be sudden weakness, shortness of breath, or feeling like you're getting the flu. Here's a simple test you can do right now. Place your fist on your chest. If the discomfort covers an area larger than your fist, if it's been going on for more than 15 minutes, or if it came with sweating, nausea, or shortness of breath, you need emergency care immediately. Carl ignored his symptoms for 3 hours because they didn't match what he expected. When his wife finally convinced him to go to the hospital, doctors found a 90% blockage in his main artery. 3 more hours, and we wouldn't be talking about Carl's recovery, we'd be talking about his funeral. Have you or someone you know experienced chest discomfort that didn't feel like a typical heart attack? Share your story in the comments. It might help save someone else's life. But chest pain isn't the only morning warning sign that sends seniors to the emergency room. The second symptom is happening in your brain, and it has nothing to do with forgetting where you put your keys. The second emergency symptom is sudden confusion or disorientation, and I'm not talking about the normal forgetfulness that comes with aging. I'm talking about waking up and not knowing where you are, what day it is, or why you can't think clearly. This is your brain's emergency alarm, and ignoring it could cost you everything. Let me tell you about 72-year-old Raymond. His daughter found him one morning sitting in his kitchen fully dressed, but he couldn't remember her name or why he was wearing his winter coat in July. He kept asking the same questions over and over. What day is it? Where am I? This wasn't dementia, this was a medical emergency. Here's what most people don't realize. Sudden confusion in seniors can signal 5 different life-threatening conditions. First, stroke. When blood flow to your brain is blocked or reduced, confusion is often the first symptom, especially in women over 60. Unlike the dramatic strokes you see in movies, these silent strokes creep up quietly, starting with mental fog and progressing to complete disorientation. Second, urinary tract infections. I know this sounds harmless, but in seniors, UTIs don't just cause bathroom problems, they cause brain problems. The infection releases toxins that cross into your bloodstream and affect your brain function. Dr. Michael Chen from Mayo Clinic reports that 30% of UTI-related emergency room visits in seniors start with confusion, not urinary symptoms. Third, medication interactions. If you take multiple prescriptions, and most seniors take an average of 7 different medications, your morning confusion could be a sign of dangerous drug interactions. Sleep aids mixed with blood pressure medications, diabetes, drugs combined with heart medications, these combinations can cause what doctors call medication-induced delirium. Fourth, blood sugar crises. Whether your sugar is dangerously high or dangerously low, your brain is the first organ to suffer. Type 2 diabetics over 60 are especially vulnerable because they often don't feel the physical symptoms of blood sugar swings. The confusion comes first, followed by weakness, then loss of consciousness. Fifth, severe dehydration. As we age, our kidneys become less efficient, and we lose our natural thirst response. What feels like mild dehydration to a 30-year-old can cause serious brain dysfunction in a 70-year-old. The confusion happens because your brain literally doesn't have enough fluid to function properly. Here's how to tell if confusion is an emergency. Ask yourself these 3 questions. Can you remember what you did yesterday? Do you know what month it is? Can you count backward from 100 by 7s? If you struggle with any of these, or if family members notice you're not acting like yourself, you need medical attention immediately. Raymond's confusion turned out to be a combination of a UTI and dehydration. The infection had spread to his bloodstream, and he was hours away from sepsis, a condition that kills 250,000 Americans every year. Because his daughter recognized that sudden confusion wasn't normal, Raymond made a full recovery. What's scary is how often families dismiss confusion as just getting older. But here's the truth. Normal aging doesn't cause sudden, dramatic changes in thinking. If you wake up confused, or if someone you love seems suddenly disoriented, don't wait to see if it gets better. Have you noticed sudden confusion in yourself or a loved one? What did you do about it? Let us know in the comments below. Now, the third symptom is one that Carl experienced along with his chest discomfort, and it's the reason his wife finally insisted they go to the hospital. 3. Difficulty breathing or shortness of breath. The third emergency symptom is difficulty breathing or sudden shortness of breath when you wake up, and this isn't about being out of shape or climbing too many stairs. This is about your body struggling to get the oxygen it needs to survive, and for seniors, it's often the first sign of a life-threatening condition. Let me share 69-year-old Diane's story. She woke up at 3 a.m. feeling like she couldn't catch her breath. At first, she thought it was anxiety. Her husband had passed away 6 months earlier, and she'd been having trouble sleeping. But this was different. She described it as trying to breathe through a straw, even while lying perfectly still. By morning, she could barely walk to the bathroom without gasping for air. Here's the critical information most seniors don't know. After age 60, sudden breathing difficulty is rarely about your lungs alone. It's usually your heart sending an SOS signal. When your heart can't pump effectively, fluid backs up into your lungs, making it feel impossible to get enough air. This is called acute heart failure, and it kills more seniors than cancer. The tricky part is distinguishing between different types of breathing problems. Asthma or COPD flare-ups usually come with wheezing and respond to rescue inhalers. Panic attacks cause rapid, shallow breathing that improves with relaxation techniques. But heart-related breathing problems are different. They're worse when you lie down and better when you sit up. You might also notice swelling in your legs, sudden weight gain, or a persistent cough that produces pink or white foam. Sleep apnea adds another dangerous layer for seniors. If you have untreated sleep apnea, your oxygen levels drop repeatedly throughout the night, putting enormous stress on your heart. Over time, this can lead to sudden heart failure, and the first symptom is often waking up gasping for air. Here's something that surprises many people. Certain medications commonly prescribed to seniors can cause dangerous breathing problems. ACE inhibitors for blood pressure can cause a dry cough that progresses to breathing difficulty. Beta blockers can trigger asthma-like symptoms. Blood thinners can cause internal bleeding that presents as shortness of breath. Environmental factors are especially dangerous for senior breathing. Changes in weather, air pollution, or even strong cleaning products can trigger severe respiratory distress in older adults whose lung function is already compromised. What might cause minor irritation in a younger person can cause respiratory failure in someone over 60. Here's a simple assessment you can do. Can you speak in full sentences without taking a breath? Can you walk across a room without stopping to rest? If you're struggling with either of these, or if you need to sleep propped up on multiple pillows to breathe comfortably, you need emergency medical care. Diane's breathing difficulty turned out to be a pulmonary embolism, a blood clot in her lung. The clot had formed in her leg after weeks of decreased activity following her husband's death, then travelled to her lung where it blocked blood flow. Pulmonary embolisms kill 100,000 Americans every year, and they're especially common in seniors who are less mobile. The emergency room doctor told Diane that if she had waited another few hours, the clot could have been fatal. The treatment was immediate blood thinners to dissolve the clot, followed by months of anticoagulation therapy. Today, she's fully recovered and advocates for seniors to take any breathing changes seriously. What many people don't realize is that pulmonary embolisms often develop after periods of immobility, long car rides, extended bed rest, or even just sitting in a recliner for hours watching TV. The blood pools in your legs, forms clots, and then travels to your lungs. Are you experiencing any breathing changes? Or do you know someone who has? Share your experience in the comments. Your story could help someone recognize their own symptoms. But breathing problems aren't the only symptom that can develop overnight. The fourth warning sign happens in your head, and it's so severe that doctors have a special name for it. The fourth emergency symptom is a sudden, severe headache, unlike any you've ever experienced before, what doctors call the worst headache of your life. If you're over 60 and you wake up with this type of headache, you could have minutes to get to a hospital before it's too late. Let me tell you about 74-year-old Eugene. He'd had headaches before, tension headaches from stress, occasional migraines, the usual aches that come with getting older. But one morning, he woke up with what he described as someone hitting me in the head with a baseball bat. The pain was so intense he vomited immediately and couldn't stand up without feeling like he was going to pass out. Here's what makes headaches especially dangerous for seniors. Your blood vessels become more fragile as you age, and many seniors take blood-thinning medications that increase bleeding risk. When a blood vessel in your brain ruptures or balloons out, it creates pressure that can be fatal within hours. This is called a hemorrhagic stroke or brain aneurysm, and the signature symptom is sudden, excruciating head pain. The key word here is sudden. Normal headaches build gradually, you feel tension developing, or you notice light sensitivity increasing. Emergency headaches hit like lightning. One moment you're fine, the next moment you're experiencing the most intense pain of your life. Eugene said it was like someone flipped a switch and turned the pain to maximum. But here's what complicates things for seniors. Many older adults take medications that can mask the severity of headaches or change how pain presents. Blood pressure medications can reduce the intensity of headache pain, making a serious condition seem less urgent. Anti-inflammatory drugs can partially relieve the pain of even dangerous headaches, creating a false sense of security. Timing matters enormously. If you wake up with a severe headache, it could mean bleeding in your brain happened while you were sleeping. The brain swelling that follows increases throughout the night, and by morning, you're experiencing maximum pressure. This is why worst headache of your life combined with morning timing is such a red flag for emergency physicians. Location and associated symptoms are critical clues. Brain bleeds often cause headaches at the base of your skull or behind your eyes, accompanied by neck stiffness, vision changes, or sensitivity to light. Stroke-related headaches might come with weakness on one side of your body, slurred speech, or facial drooping. Aneurysm headaches often cause pain that radiates down your neck and into your shoulders. Here's a crucial distinction many seniors miss. Migraine headaches, even severe ones, usually have warning signs. You might see flashing lights, feel nauseous, or notice sensitivities building up over hours. Emergency headaches have no warning, they're sudden maximum intensity from the first second. For seniors with high blood pressure, which includes 75% of people over 65, sudden severe headaches can signal a hypertensive crisis. This is when your blood pressure spikes so high, it damages your brain, kidneys or heart. The headache comes from blood vessels in your brain stretching beyond their limits. Eugene's headache turned out to be a ruptured aneurysm. The emergency surgery to stop the bleeding saved his life, but only because his wife insisted they call 911 instead of waiting to see if the pain would improve. The neurosurgeon told them that aneurysm patients who wait more than 6 hours have a 50% mortality rate. Here's a simple rule. If you're over 60 and you experience the worst headache of your life, especially if it's accompanied by vomiting, neck stiffness, confusion or vision changes, call 911 immediately. Don't take pain medication to see if it helps. Emergency headaches need emergency treatment, and pain relief can mask symptoms that doctors need to evaluate. Another important factor for seniors is the interaction between headaches and common medications. Blood thinners like warfarin or newer anticoagulants increase the risk of brain bleeding, making sudden headaches even more dangerous. If you take these medications and develop a severe headache, emergency evaluation is essential. Have you or someone you know experienced a sudden severe headache that felt different from anything before? How did you handle it? Share your story in the comments below. Now, the fifth and final symptom is the one that surprises everyone, including doctors. It happens in your stomach, but it has nothing to do with what you ate. 5. Unexplained severe abdominal pain. The fifth and most surprising emergency symptom is unexplained severe abdominal pain. And here's the shocking part, it might not be about your stomach at all. For seniors, sudden abdominal pain can be a warning sign of heart attacks, aortic ruptures and other life-threatening conditions that have nothing to do with digestion. Let me share 71-year-old Carolyn's story. She woke up with intense pain in her upper abdomen that felt like the worst food poisoning of her life. She assumed she'd eaten something bad at her granddaughter's birthday party the day before. The pain was so severe she couldn't stand up straight, and she felt nauseous and dizzy. For 6 hours, she tried to wait it out, drinking ginger tea and lying on the couch. It nearly cost her life. Here's the critical information that could save your life. After age 60, your body doesn't always send pain signals to the right location. This is called referred pain, and it's especially common in seniors. Heart attacks can cause upper abdominal pain that feels exactly like severe indigestion. Aortic aneurysms, when the main artery in your chest or abdomen balloons and threatens to rupture, often cause back pain or stomach pain rather than chest pain. The reason this happens is that as we age, our nervous system becomes less precise at pinpointing the source of internal problems. The nerves that carry pain signals from your heart, your major blood vessels, and your abdominal organs all converge in the same area of your spinal cord. Your brain receives the pain signal but can't always identify exactly where it's coming from. For women over 60, this phenomenon is even more pronounced. Female heart attacks commonly present as upper abdominal pain, nausea, and vomiting, symptoms that are almost identical to gallbladder problems or severe gastritis. Dr. Lisa Rodriguez from Cleveland Clinic reports that women are 30% more likely than men to experience heart attacks as abdominal pain rather than chest pain. Here's how to distinguish emergency abdominal pain from digestive issues. Emergency pain is usually constant and doesn't improve with position changes, antacids, or bowel movements. It often comes with other symptoms like sweating, dizziness, shortness of breath, or pain radiating to your back, shoulders, or jaw. Digestive pain tends to be crampy, comes and goes in waves, and often improves after using the bathroom or taking antacids. Timing is another crucial clue. If you wake up with severe abdominal pain that's different from anything you've experienced before, especially if it's accompanied by weakness, nausea, or feeling like you're going to pass out, this could be a vascular emergency. Aortic aneurysms in particular often rupture in the early morning hours when blood pressure naturally rises as you wake up. Medication complications add another layer of danger for seniors. If you take arthritis medications like ibuprofen or naproxen regularly, you're at higher risk for stomach ulcers that can suddenly perforate, causing severe abdominal pain and internal bleeding. Blood thinners increase the risk of internal bleeding from even minor stomach irritation. Age-related changes in your immune system also mean that serious abdominal conditions don't always cause the symptoms you'd expect. Appendicitis in seniors often presents as mild, vague abdominal discomfort rather than the sharp, right-sided pain younger people experience. By the time the pain becomes severe, the appendix may have already ruptured, leading to life-threatening infection. Carolyn's abdominal pain turned out to be a massive heart attack. The blocked artery was causing her heart muscle to die, but instead of chest pain, her body sent all the distress signals to her stomach. When she finally arrived at the emergency room, her heart had sustained significant damage that could have been prevented with earlier treatment. The emergency cardiologist explained that belly pain heart attacks are responsible for many delayed diagnoses in senior women. The symptoms are so convincing that both patients and sometimes even doctors initially treat them as digestive problems. This delay in proper treatment significantly increases the risk of death and long-term heart damage. Another dangerous condition that presents as abdominal pain in seniors is mesenteric ischemia, when blood flow to your intestines is blocked. This condition is almost exclusively seen in people over 60. Particularly those with heart disease or atrial fibrillation. The pain is often described as out of proportion to physical findings, meaning you're in excruciating pain, but your abdomen doesn't look or feel abnormal when examined. Here's a simple assessment. If your abdominal pain is severe enough to make you double over, if it's accompanied by sweating or dizziness, if it doesn't improve with rest or antacids, or if it feels completely different from any digestive pain you've had before, you need emergency medical evaluation immediately. The key message is this: as we age, our bodies become less reliable at telling us exactly what's wrong and where. Severe abdominal pain in seniors should always be considered a potential emergency until proven otherwise. Have you experienced severe abdominal pain that turned out to be something other than a digestive problem? Share your story in the comments. It could help other viewers recognize when stomach pain is really a medical emergency. These 5 symptoms, chest discomfort, confusion, breathing difficulty, severe headache and abdominal pain, are your body's emergency alert system. But recognizing them is only the first step. Here's the life-changing truth. Every single person I've told you about today, Carl with his chest discomfort, Raymond with his confusion, Diane with her breathing problems, Eugene with his headache, and Carolyn with her abdominal pain, they all survived because someone recognized that these symptoms weren't normal aging. They were medical emergencies. The statistics are sobering but hopeful. When seniors recognize these 5 warning signs and seek immediate medical attention, survival rates jump by 60%. When they delay treatment thinking symptoms will improve on their own, mortality rates triple. The difference between life and death often comes down to a single decision. Do I wait to see if this gets better, or do I act now? Carl now carries nitroglycerin and knows the signs of heart problems. Raymond's family has a medication management system and regular UTI screenings. Diane uses compression stockings and stays active to prevent blood clots. Eugene monitors his blood pressure religiously and knows when to call 911. Carolyn has learned that for senior women, heart attacks don't always feel like heart attacks. But here's what transformed all of their lives. They stopped assuming that serious symptoms were just part of getting older. They learned to trust their instincts when something felt wrong, really wrong. They discovered that taking their health seriously isn't being dramatic, it's being smart. Your body has spent decades taking care of you. Now it's your turn to take care of it by listening when it's trying to tell you something important. These 5 symptoms are your body's way of saying, help me now, not later. The question is, will you listen? If this video could save a life, and it absolutely could, hit that like button right now and share it with everyone you care about. Your parents, your spouse, your neighbors, your friends over 60. Someone watching this video today might recognize these symptoms in themselves or a loved one next week, next month, or next year. Tell me in the comments, which of these 5 symptoms surprised you the most? Have you experienced any of these warning signs yourself? Your story could be the one that convinces someone else to seek help when they need it most. And if you want to keep protecting yourself and your family, subscribe and hit the notification bell.